Hello, I am in the Villages, Florida, and I just drove in today after spending the last couple days in Daytona Beach, just relaxing and enjoying the beach. And now I am here in the Villages, and I'm here to meet with everyone at AVIV Clinics. They invited me down to show me a tour of their state-of-the-art facility and to meet some of their executives and their providers and the rest of their staff. So I'm really excited for what I'm gonna experience the next 2 days that I'm here. And AVIV specializes in hyperbaric oxygen therapy, or HBOT, and their facility, their HBOT isn't your traditional HBOT when you think of it. It's not those small capsules that you get into, whether it's hard or soft-sided. It's actually an entire room, and you do HBOT in a room in a comfy recliner with a like an iPad or whatever, and you're in this room with a couple other people, and the room itself is the HBOT chamber. So if if you have any of those claustrophobia concerns with HBOT, you don't have to worry about that because it's literally like just being in a living room. So I'm excited to share that with you, their HBOT room. But they specialize in working with individuals with brain injury, concussion, and other neurological conditions. That is their specialty. And so I'm really excited. I'm going to meet with some of the different providers and get an opportunity to hear, how they work with the brain injury population. And I also get to experience a few modalities while I am here, which I'm very excited about. And I'm going to try and record as much of this journey as I can to share it with you and give you some insight into AVIV Clinics. So stick around, and I hope to show you lots of really neat stuff over the next day and a half.
So my name is Paul Moore. I'm the clinical program manager. No one knows what that means, so they usually call me the chief nurse. I've been a registered nurse for 30 years. I have a master's in healthcare administration. My last 2 jobs, I ran hospitals. One of them was an orthopedic specialty hospital that Mr. Globig, our CEO, and I opened together.
Oh,
yes, and
very cool. So you've known him a while.
Yes, absolutely. And so that's how I ended up here.
Cool.
But great to meet you today.
Yes.
Excited about it. I want to tell you a little bit about what we have planned for you tomorrow in the morning, then I'll let you ask me a bunch of questions. Okay, so you need to not eat anything after midnight tonight. Okay. We want you to drink lots of water. Mm-hmm. So that's because we're going to be drawing your blood, and we don't want you to be dehydrated. Now, coffee and caffeine will dehydrate you.
Yeah, mine's decaf.
Oh, okay,
But
all
still.
right. But still, yes. So drink lots of water.
Yep.
And then we're gonna draw your blood. We will, send it off to be resulted. The doctors will talk to you about it. It takes days to get that back. I don't expect it to be back by the time that you leave, but I expect that we'll set up a Zoom meeting so
Cool.
you can. I think you're meeting with Dr. Cook, so I think we'll set up a Zoom meeting so you can meet with Dr. Cook and he can discuss it with you.
Great.
So I'm looking forward to that. Now, a few other things. We're going to get an ECG on you, and Brittany is my nurse that's going to be taking care of you in the morning. She's phenomenal. And then we're also going to do this cool thing called a Seika. So that is a body composition machine. So if you talk to most dietitians, they want to throw out your scales because everybody focuses on the wrong things when they focus on weight. So we will take your height and weight, but when we get on this machine, and I'm going to ask you first, do you have anything electrical in your body, like a pacemaker? Or
No.
You don't? Okay, very good. Then you can do this.
No, just a screw in my big toe.
That won't stop anything. We're golden. So we're going to ask you to take off your shoes and socks, and we're going to get your height, and we're going to get your weight, and then we're going to have you hold on to the machine. The machine will send a little electrical impulse over about 17 seconds through your body. What's great about this is it actually measures your muscle, your fat, your hydration.
Breaks it all down.
Yes, and this is different than what you see marketed out there with scales. The scales are telling you they're
drinking my water.
Yeah, the scales are telling you their body composition, but they're actually not. They use an algorithm, they use math to figure that out. So they're not necessarily accurate.
Right.
This is completely accurate.
Wow,
Okay,
that's cool.
So we're gonna take a look at that for you, and we're also gonna do your medical history. Now they were gonna send you what's called a medical problem list in your email.
Okay.
Okay, and that's just like any medical problem list that you'll get at any doctor's office.
Yep.
And you can go through and fill it out. If you don't get a chance to fill it out, you can talk to Brittany tomorrow and she'll take you through it.
Cool.
Okay?
Mm-hmm.
Any questions about any of those nifty things?
No.
So, and if you were doing the program, if you were doing our protocol, then after we took you through 60 hyperbaric sessions, then we would repeat
Do it all
of this. Yes. So, because make no bones about it, subjectively, we want you to have a great experience. I want you to love every minute that you're here. I want you to be treated well. I want you to feel like you're treated well. But in the end, we want to give you objective findings. So we want you to feel great. We want you to feel like you've improved, but we want to give objective findings like lab work and the body composition, like the scan of your brain. So you're looking at the perfusion, your blood flow, and those kind of things.
And then I know tomorrow afternoon I'm doing the CPET.
Okay, so you want to make sure and wear something that you can exercise in, because it's exercise. It may be on the treadmill, it may be on a bike. They'll ask you on whatever you're comfortable with. And sometimes, people will have issues with knees or whatever, and
Sure.
you'll decide with the physiologist which way is important. A CPET, so I don't know if you remember in the old days, they used to have these Olympians, these athletes, and they would have commercials, and they would be on the treadmill, and they'd have a mask on, and they'd have the electrodes on. That's what we're going to do with you. So it's like a stress test. The difference is we're not going to tell you to quit. We're going to tell you to go. We're going to tell you to push as hard as you can push. And then we would treat you for 60 treatments, and then we would do the post and we would compare. So our protocol is very, very comprehensive. So we have physiology, physical therapy, dietitian, neuro, physicians, nurses. So it's very comprehensive. So we're not just about hyperbarics, we're about teaching you a way of life. And so what typically happens is that people continue to improve after they've left us.
Right.
But that's why we assess everything. We want to build a program just for you. And that way we know that program is going to work for you.
Because no two people are the same.
We're talking about
regardless of brain injury. Yeah.
We're talking about biology.
Yeah.
So it's never the same. So that's what the CPET is.
Awesome.
Okay.
I'm excited.
Yep. So this right here, right before that, is a neurocognitive evaluation, and so we're gonna test and see where you're at for your cognition.
Cool.
So when you walk in the building, you
like
see
a mini neuropsych.
Yes, yeah, absolutely. And when you walk in the building, you see the awesome brain out there with all the neuro connections. And so we're after your brain. There's no doubt about it. Yeah. And we want you to improve. So in order to measure that, we need a baseline. So we're gonna get the baseline on you tomorrow.
Very exciting.
Yeah. Do you have any questions about anything?
You said no eating after midnight.
Yes, please.
Or I'll turn into a gremlin.
Yep. That's right. But drink lots of water.
Yes.
Yeah.
Yes.
Want to be able to get your blood.
And my exercise clothes, no problem.
Yep.
I live in those nowadays.
Oh yeah, absolutely.
So you probably ask yourself, why does a neurosurgeon do hyperbaric medicine? And when I started residency as a neurosurgeon, traumatic brain injury was the bread and butter of what I did. I did many operations on traumatic brain injury. Of course, we had patients that we did not operate on, but suffering significant disabilities and post-concussion syndrome. And I found that our ability to help is very, very limited. And I saw those patients months after years without much help, and I was really frustrated. And I remember calling my mentor, Shai Frati from med school, talking to him about TBI, and he said, yes, we should be starting our clinical trial on traumatic brain injury with hyperbaric medicine. And I said, wow, that is awesome. Count me in. that's how I joined the workforce. I joined him to do all the trials, and TBI I think has a big place in my heart for. And when I talk about TBI, it's a spectrum, right? We have post-concussion syndrome, we have severe TBI, and everything in between. And we have found we are able to help most of them. And the reason I'm saying most of them, because what we are doing is we are selecting patients based on their imaging. We're doing very specific images, and of course we can talk about it more. We're doing specific images to see if there are areas of the brain that are dysfunctional, and we are able to change with our protocol. If we find those, we call them brain wounds. We call those dysfunctional metabolic areas brain wounds. Just like a wound in your leg, we have a wound in our brain tissue.
Yeah, I love that.
If we find those areas, we can treat. This treatment can improve cognitive function, motor function, as well as other functions, depending where are the wounds located.
So anyway, I had my visit with AVIV the last 2 days. I had a full tour of their amazing state-of-the-art facility. Their main focus is on brain health and, helping to slow down the aging process. And they specialize in working with folks with brain injuries and other neurological conditions. And HBOT is kind of their special sauce, I guess you could say, hyperbaric oxygen therapy. And it's very, very, very different from any HBOT you would get at just, a traditional clinic. It's actually a pod, and you're in a dive with probably 10 to 12 other people at a time. So it's, if you're claustrophobic, it's not at all like going into those tubes, the individual ones. So anyway, they do a 12-week program. You have to commit to 12 weeks to work with them. Again, they're located in the Villages, Florida, which is just outside Orlando, very close to Orlando, so pretty easy to get to. But I got to meet with so many of their staff members. I got to experience some of their testing, their intake testing. I did a CPET, which is a cardiopulmonary exercise test. That was really exciting. I can't wait to see my results from that. I did some other lung testing, lung and breathing tests. I had my blood drawn. I have not gotten those results back yet. That'll be like a week or two. And then I also did some of their cognitive testing, similar, to like neuropsych testing, but it's all computerized, and the whole process only takes about an hour to an hour and a half, unlike, your 6 to 8 hour neuropsych exam. So such incredibly kind, wonderful people. I really enjoyed meeting with Dr. Amir. Amir Hadani. He is their kind of lead researcher, and he actually came up with the protocol for hyperbaric research for the placebo. So traditionally, the placebo had been done by taking the patients or the subjects to an atmospheric pressure that would make the ears pop, and they kept them there. So they were still receiving the benefits of HBOT, just at a lower pressure, right? So think of it like a 500 milligram Tylenol versus a 100 milligram Tylenol, right? They were just getting the 100 versus the 500, but they were still seeing benefit and results from it. So therefore they thought the research proved that HBOT wasn't working, because both groups seem to have the same results. Well, so he developed the research, he developed the protocol. He takes the subjects to atmosphere to make their ears pop. But then after their ears pop, they bring them back up to no pressure. They're not receiving any oxygen. It's just air pumping in. And so once your ears pop, you would have no idea that you are not under pressure or receiving HBOT. So when they changed it, so now the placebo is not under pressure, right? They just get it to make their ears pop, because if your ears didn't pop, you would know you were a placebo, right? So their research shows without a doubt that HBOT, the control versus placebo, right? That there's definitely benefit versus not having HBOT. So that was really exciting to talk with him. Like I said, he is the one who developed the protocol, and that has changed HBOT research like drastically. So that's very exciting, and just to hear about all the research proving, HBOT has incredible healing effects. We're literally trying to heal the brain wound with HBOT versus some of the other modalities. We're just trying to kind of rewire the brain to make it more efficient, where this is they're targeting actually healing the brain. So that was super profound to me. I was kind of blown away by all that. So that was very exciting. It was very cool to see their facility and meet their staff. Like I said, they're just like the most kind, sincere, authentic people. You just feel so at ease and comfortable at their clinic. I can't wait for you to see some of my footage from AVIV. Anyway, they are currently underway to bring a clinic to New York, right to Manhattan. So there is the one here in Florida, there's one in Israel,